An expert in aged care policy will be giving evidence this morning, telling the Commission that he advised the government back in April to send in ADF personnel or other workers into aged care homes. Professor John Ibrahim said they would be able to assess the risks and ensure that homes had enough resources to deal with potential outbreaks. But it took the federal government another 3 months before it established the Victorian Aged Care Response Centre, as coronavirus outbreaks were really spiralling out of control. Now, today's evidence is a key factor in claims the federal government didn't develop a COVID-19 plan for the aged care sector, but that assertion has been rejected by the acting Chief Medical Officer.
That is not correct. We have been planning for our aged population as a vulnerable group since the beginning of our planning in relation to COVID-19. The first reports out of China in January, which led to the formulation of the Australian Health Sector Emergency Response Plan for novel coronavirus, which is here and was launched by the Prime Minister in early February, makes very specific mention of those vulnerable groups.
Pete, yesterday the Royal Commission heard evidence of disagreements and dysfunction over whether to send COVID-positive patients from Sydney's Newmarch house to hospital. Today, the Australian newspaper reports there is a similar stoush between the Victorian and federal governments, which is resulting in elderly, sick residents being turned away from hospitals and in some cases sedated to keep them isolated in understaffed nursing homes. Pete?